Hello viewers, you're welcome to another enlightening episode of HealthAfrik. In our previous episode, we celebrated the One Health Day, as well as created awareness on the importance of adopting the concept. In this episode, we are joined by an expert all the way from Nigeria, who is going to help us explore the One Health concept, as well as discuss its relevance in controlling infectious diseases. My name is Isabella Teta Hinapa. Stay with us as we go for a quick break, and when we come back, I'll introduce our guest to you and then start with the discussion. Stay tuned. You're welcome back from the break. This is still HealthAfrik, and this episode we are going to focus on One Health approach. That is an approach that recognizes the interconnectedness of human, animal, and then environmental health. And currently, it is proving to be a game changer in controlling or fighting against infectious diseases. As I mentioned earlier, we are joined by an expert all the way from Nigeria. He goes with the name Dr. Samuel Akpan, and he's joining us via Zoom. Dr. Samuel Akpan is an epidemiologist, and he's going to help us discuss the concept of One Health, as well as its importance in fighting against infectious diseases. Hello, Dr. Akpan.
Hello.
You're welcome
Hi,
to
viewers.
HealthAfrik. You're welcome to
Yeah,
HealthAfrik.
thank you so much. It's good to be here.
Great. Now, before we start with the discussion, we would like you to introduce yourself to our viewers. Though I've mentioned your name, who you are, we'd like you to tell us more about yourself.
Okay, my name is Dr. Samuel Akpan. I'm an epidemiologist.
Okay,
I'm a trained veterinary epidemiologist now,
great.
and I'm also an infectious disease ecologist.
Okay,
Currently, I'm a doctoral researcher at the Africa Center of Excellence for Genomics of Infectious Diseases.
okay.
I'm also a doctoral researcher at the One Health Center for Africa, which is domiciled at International Livestock Research Institute, Kenya.
Great, great, great.
Thank you.
It's a pleasure to have you on HealthAfrik.
Thank you. It's my pleasure too.
Great. Now, my first question, or what we would like to know about, is you giving us a comprehensive definition of what One Health is. To me, my understanding is when our human health, animal health, and then environmental health comes together. That is how I understand it. But you being an expert, can you give us a comprehensive definition of it, and also how relevant it is in fighting against infectious diseases?
Okay, it is an aspect of what you already know, like you said. But then, if I must summarize it, One Health is actually an approach
Okay.
which is aimed at tackling diseases from different perspectives. In this case, the human perspective, the animal perspective, and the environmental perspective. And lately, from the plant perspective. Yeah.
Mm.
So it is an approach, it is a concept that says that health for one of those aspects I mentioned is health for all. If there is anything wrong with environmental health, then there will be something wrong with human and animal health. If there's
Okay.
anything wrong with human health, there'll be something wrong with the other two, which is the animal health and likewise for the three of them.
Mm-hmm. And how relevant is this to fighting against infectious diseases?
Yeah, this is very relevant because experience has it that experience has proven that fighting infections outbreaks from one aspect does not entirely deal with the issues of global emerging disease outbreaks.
Okay.
Because, take for example a disease like malaria.
Mm-hmm.
Initially, when malaria was being fought, it was from the human aspects. Someone has malaria, he's admitted in the hospital. But what about the mosquito?
Mm-hmm.
After the mosquito, which is like the animal aspect, what about the forests? What about the bush? There must be something that is breeding mosquitoes, and then mosquitoes are in turn coming into human dwellings to infect people with the plasmodium parasites.
Yeah, okay. Now, I, for instance, heard about One Health I think after the COVID-19, I attended a conference and then I had One Health, One Health. Now, what were the key drivers behind the emergence and development of this approach?
Okay, I think One Health has been a concept that has been known before now, but it wasn't generalized. It wasn't a generalized term, and people didn't really get to know it. But as early researchers like Rudolf Virchow had already said that, they had already identified with the concepts, and then, but the main way it came out was through a man called Calvin Schwab in
Okay.
1964 when he called it one medicine. It wasn't initially called One Health. He called it
Mm,
one medicine because he actually introduced it in his book, and he said that he noticed that there were similarities between animal diseases and human diseases. So after that, other events such as the Wildlife Conservation Society in 2004, they held a
mm,
conference where it was called One World, One Health Conference. And they actually also talked about the One Health. And subsequently, but the main reasons that made One Health come out is diseases like a highly pathogenic avian influenza. That was when the American Veterinary Society came together and then
okay.
started recommending One Health as a means of controlling these infections. And then sometime in 2008 too, world bodies like FAO, WHO, UNICEF, UNESCO also came together, and then they recommended through a framework which
Okay.
was to control and tackle zoonotic diseases at the human-animal environment interface.
Mm. Now, when we say zoonotic diseases, my understanding is a disease that can transfer from an animal to human. That's right?
Yes, yes.
Great. Now, although you've made an example of with mosquito in explaining the One Health approach, I'd like you to make like emphasize on how the approach helps in tackling infectious diseases, especially the ones that affect both humans and animals. How does the approach helps in understanding and also in tackling that disease?
Okay, I'd like to use diseases that are more recent, outbreaks that
Okay.
were more recent, something like maybe monkeypox or
Okay.
Lassa fever, which is still ongoing in part of West Africa.
Yeah.
You know that the monkeypox is, or let me use the Lassa fever. Okay, let me use the Lassa fever now. The Lassa fever is transmitted by a rodent, by the rodent, like multi-mammate rats.
Mm,
Now, if there is a Lassa fever outbreak, the outbreak investigation, for you to be able to get to the root of the matter, is not just to get the human beings that were infected and then we'll do case control, we treat them and discharge them. It is still circulating. So
okay.
what we do is an outbreak investigation to trace where did this come from. That is where the veterinary aspect comes in, the animal aspect. So you
Mm,
go to control the source, which is the multi-mammate rats.
okay.
Now, how does the multi-mammate rat proliferate? How do they multiply? They multiply in swampy areas, areas where you have, so you look at their ecosystem. So without having to treat people, if you want to reduce the number of people being treated, you have to go to the source, which is
Okay.
through the animal aspect, and then you check the environmental aspect. What is it in a seasonal variation? For example, sometimes you find out that in the cold season,
Mm,
you have more diseases sometimes than in the dry season. Sometimes in the dry season. So that is the environmental aspect. So you're going to find out what are the seasonal similarities, what are the seasonal peculiarities that make these diseases or these vectors to be able to breed, to be able to transmit to human.
mm,
So when these three aspects are carried out, that is when you can effectively control a disease. If not, what you're just doing is just a temporary treatment, and then
mm.
it's going to reoccur.
Yeah, I think,
Monkeypox is the same thing.
yeah, yeah. I think even this answers my next question. I was about asking at what point will a veterinarian come and at what point will an environmental specialist come and at what point will a general healthcare professional also come in terms of the One Health approach. But yeah, if you
Okay,
can,
I think I can still chip in something
okay,
to that.
okay.
Now, this is where multi-sectoral collaboration comes in. Now, when there is a disease outbreak, an
Mm,
incident, this is how it happens. First of all, it's called a suspected case. So a team is formed.
Okay.
This team would have a physician, have a veterinarian, have
Mm.
an environmental expert. Now, One Health goes beyond these three aspects actually. You need a statistician also. You need somebody who is into GIS and all of that. You need an accountant. You need a lot of people to form the team. You need nurses. So you attack it from different areas. And then you
Mm.
say, for example, this is where it comes in. The human physician describes the disease in terms of the clinical signs that is seen in the human being. He could say this is a hemorrhagic disease. It causes bleeding from the nostrils, from the openings, orifices in the body, or it causes
Mm.
chills, headache, and fever. That is where it stops. And then he'll be able to say, okay, this is the treatment line that can be given supportive therapy and all of that for a number of days. But that is where now the veterinarian comes in and says, this pathogen matches the pathogen that is prevalent in a monkey. This was
Mm.
also seen in a monkey. Now, the outbreak investigation will now go into contact tracing. Did this human being have a contact with any wild thing, or did he
Okay.
go to and all of that? Now, the
Mm.
environmentalist comes in. What environmental factor could have made this human being to come in contact with
Mm.
this? And under what kind of condition can this pathogen be able to evolve, for example? Now, another environmental aspect I want to state here is the aspect of deforestation, for example. That's an environmental aspect. When the government is building roads, building, you understand, bringing
Mm.
down massive forests to do estate and all of that is good for civilization, but it's also an issue for One Health because environmentally, you are now rendering those wild animals homeless. What are they
Mm.
going to do? They're going to move into human habitats. And
Mm.
as they move in, the pathogens or bacteria and viruses that were normal inhabitants of their bodies now
Yeah.
become a problem because they're going to be transmitted. And then human beings, apart from waiting for us, for the animals to come to us, we encroach into their habitats. When you are building a road and tilling the soil, let me use the example of the anthrax. It has been discovered that anthrax can dwell in the soil for anthrax spores
Mm.
and survive in the soil for many years.
Okay.
Okay, let's say an animal has an anthrax disease and then is able to shed it in the feces, in the droplets, and it's buried in the ground. So when you go till and you're trying to do massive, you are actually pulling them out and spreading them.
Mm.
Now, environmental aspect too, rain comes, heavy downpour comes, erosion, climate change differences, and then there is erosion, there's massive flood. It now carries these spores
Everything. Yeah.
to water
Yeah.
sources. Remember, these water sources, people are using them to bathe in different
Mm.
areas. Some municipal water systems derive water from these rivers, with they treat. And now, some of these treatments that they do are not effective on some of these spores. They're only
Mm.
effective against some of the bacteria or whatever that they have
Materials.
discovered. So
Mm.
this is how it can get through one common source and is spread in a community.
Exactly.
So everything is linked together. One
Mm.
problem in a certain area, and then you have problem everywhere.
Exactly. I like the fact that currently we are looking at different approaches in dealing with infectious diseases. What
Yeah.
would you say would be some of the benefits of this approach?
The One Health approach, number one, would make sure that there is early detection and early
Yeah.
warning.
Okay.
For example, um, I just talked about flooding now and what it can do to the soil and all of that,
Mm.
bringing
Mm.
in spores to river sources. So environmentalists can warn that this season there's going to be
Rainy
meteorologists,
season.
for example, a lot of rain.
Mm.
You understand? And then at that, you know that if this happens, what will be the next thing? Climate change
Mm.
issues.
Mm.
So these people need to be brought into the team when we are doing an outbreak for disease. Yes,
Mm.
they are not called scientists, but this is how they can also help. Now, when they are able to predict that, you begin to say, okay, what can happen if there's a flood, for example? Are we going to lose animals? I'm coming in from a food security angle now. When there's
Mm.
flooding, a lot of animals sometimes are swept into large drains of this thing. And loss of animals result to what human beings are always the end point. We are always at the receiving end
Yeah.
because there's going to be food insecurity. There's not going to be enough meat for people. There's not going to be enough crops for people to feed on. And that in turn has an
Mm.
adverse effect on human health, because if you're not feeding well, the nutritional aspect is not there because there is drought because of no food, there's famine in the land. So it's just interconnected like that.
Okay, great. All right, Dr. Pan, we are going to go for a quick break, and when we come back, we are going to look at some of the challenges in adopting to the One Health approach. Well, you're welcome back from the break. If you just tune in, this is HealthAfrik. And on this episode, we are discussing the One Health approach as well as its relevance in fighting against infectious diseases. And with us is Dr. Samuel Akpan from Nigeria, joining us via Zoom. Hello, Dr. Akpan.
Hello.
Thank you for sticking with us.
It's good to be back.
Now, my next question is going to be on the challenges. We say that in everything, there's the good and bad. What, being an expert, what do you foresee or what do you think will be a challenge for health experts adopting to this One Health approach?
First of all, I don't think there has been enough awareness, first and
Okay.
foremost.
Okay.
A lot of experts are just getting to hear about One Health.
Mm.
Okay, a lot of people are hearing about it, a lot of experts are hearing about it, a lot of health sector professionals are hearing about it, but they don't know how it can work out.
Yeah.
So that's part of the problem now. There is no not adequate awareness. And then for those that know, there is lack of collaboration.
Mm.
I don't know if it's sometimes in the research areas, you find out that someone in the veterinary aspect makes a discovery and may not want to bring in someone from the core human medic because they want to publish it, they want to make a name out of it, and then environment. So we are operating singly, we are operating according to
Mm.
our because so I think also because these trainings were not done in schools
Okay.
at the scratch,
Mm-hmm.
because that is where you're supposed to be aware that when you graduate from studying physics, when you graduate from studying geography, you can actually work with a medical doctor in a certain aspect. So that's also another. And then the last reason I could see as a challenge is lack of willpower by the government. Yes, we talk about it, but when there is an outbreak, are you going to be ready to bring in a statistician, an accountant? Are you going to be ready to bring in a social scientist to look at the social determinants, socioeconomic aspects? Are you going to bring in a physician to look at a case of diarrhea? You're going to be able to bring in a human medic to look at issues of brucellosis in animals.
Mm. Now, mentioning all these challenges, I would like to ask, what do you think the government, institutions, educational institutions, health authorities can do in solving these challenges?
I think first of all, like I mentioned, the challenges. So direct opposite of each of those challenges to actually solve
Mm.
this problem. The first one would be to increase awareness
Okay,
of
and
One
how can
Health.
that be done?
It can be done through the mass media, for example, reaching
Yeah.
out to the schools,
Okay.
enlightenment campaign in schools, enlightenment campaigns to the churches, enlightenment campaigns to mosque, places of worship, marketplaces to market women, and all of it. They should know that if you throw a nylon to the into the river, it's actually going to get in the way of maybe a sea turtle or a fish or something, and that is going to result to suffocation and death of maybe aquatic life. If there's death in aquatic life, what does it mean for the environment? Number one, the aquatic life is going to stay there and other fishes are going to feed on it. It's going to be a problem for whoever is drinking water from there.
Mm.
Number two, a few fishes may die, which will result to food insecurity. So everybody must be made to know that a problem for one aspect is a problem for all. The
Mm.
second
Yeah.
aspect is for government to make and create at least an office in each of the parastatals of health bodies,
Okay.
a
Okay.
desk office for One Health. Now, what this person would be responsible for doing is to check each coordination, each committee that is being set up, each approach that is being done, does it follow the One Health approach? For
Mm-hmm.
example, when we talk about diphtheria in children and the government is responding to it, what the desk office should do is to check in setting up this body, in setting up this outbreak response. Did it represent the One Health approach, or is it just getting the children to be able to treat them, and does it involve all these aspects so that we can have a long-term solution to this
Yeah,
issue?
great, great. Now you made mention of collaboration. Let's say a viewer watching this episode, and I'll be like, okay, I'm interested in collaborating to, play a role in the One Health approach. But
Yeah.
then the person may be thinking, what are the ethical considerations in this approach? What would you advise, or what would be your advice to the person?
Okay, ethical considerations would really apply in terms of, for example, you're talking about maybe somebody watching us now,
Yeah,
and then
yeah.
he would want to. Now, you can do the One Health approach right where you are. You don't need to belong to any organization to be able to do it.
Okay.
You just need to know that if you are keeping a dog and
Mm,
you're not feeding the dog, for example,
mm,
you are not doing well.
okay. Okay.
Yes. You need to also know that if you're keeping a dog, I'm just coming from the scratch where people can understand.
Yeah.
And you are keeping a dog and you're not feeding it, and it's a stray dog just moving around, it can actually contact rabies
Mm-hmm.
and transmit it to a human being.
Mm-hmm.
So you're actually playing a role in helping and making sure that diseases evolve. So your role, the role of the common person could be to make sure that whatever you do, you think, this action I want to take now, what will be the impact on my neighbor?
Mm-hmm.
What will be the impact on animals that are drinking water from that source? What will be the impact on the environment? If I threw away this, maybe I took a drug and I just passed a water source and I threw it into the water, what will be the impact? That's how
Mm-hmm.
people can actually collaborate beyond the larger part
Yeah.
where you go into. So look at welfare of animals, look at the ecosystem, the environment, how neat it is, and also look at yourself as a human being. How can you be hygienic in washing your hands, in making sure that zoonosis is not just being transferred from animals to human, for example. Let me say
Mm-hmm.
this. There's
Mm-hmm.
classical zoonosis cases where humans can also transmit to animals.
Oh, really?
Yes. Yeah, there were cases in the US where the SARS-CoV-2 19 were transmitted to a zoo lion.
Animals. Oh,
Yeah,
really?
yeah.
Wow.
Yeah, it's both sides. So
Yeah.
if you do that and you're not hygienic enough and you defecate in public places and they are shedding a virus and some of these stray animals go take it and then they go to a water source to drink water, they drop it there, they go to bite someone, they go, so it's just going round and round and round.
Mm, mm. No.
So anybody wants to collaborate, it should be at your own level where you
Yeah.
are, the
Exactly.
everyday life that you live.
Exactly. Also, talking about creating awareness, I think recently I saw your flyer. You were going to give a speech on the One Health Day, right?
Oh
So
yeah, yeah.
from your end, what are your institution doing to create more educational awareness on the One Health Day? I'm sure someone will be listening to tap in and also do something from their end.
Yeah, we are doing massive awareness for people to know that One Health is not just a concept where you talk about on the air and everybody hears. We are looking at, like I just said now, what you can do at your level where you are in your office? Are you discharging your sewage very well? Are you
Mm,
treating the wastes before they go in? A lot of people are living in places where they are pushing in their domestic waste into water sources. So what
mm,
exactly are you doing at your end too? So that's where the awareness level is going to into the schools, also into the students in higher institutions. My institution is actually attached to a higher institution, Redeemers University in Nigeria. We're also raising awareness at the lifestyle of students and how whatever they do can also impact on the environment. And mind you, when they are bringing down forest here to build new places, there's a targeted reforestation. We
mm-hmm.
look at, okay, we are bringing down this forest. Okay, why don't we plant trees that
Something,
can
yeah,
also
to
grow in the next
replace.
10, 15 years to
Mm,
also help with
okay.
climate change mitigation?
Great. Great. I think we've exhausted our time, but then before we wrap up, what would be your final words to our audience who are now embracing the One Health approach?
Okay. So first of all, to medical practitioners, be
Mm-hmm.
ready for something new. Be ready to embrace people from other professions. We are all fighting towards the same goal. And for my viewer listening here, your everyday activity, your everyday decision can affect one health. What you cook, what you drink, how you behave, how you discharge your waste can also affect one health. So everybody, let's make up the decision and know that health for one is health for all. Don't say this is
Exactly.
just an animal, because
Mm-hmm.
if an animal dies on the road, flies can perch on it and pick up a virus and rest on your food. And the next moment you're having food poisoning. So it's
Mm-hmm.
everything. So when we see dead things on the way, let's be able to say, okay, let us deal with this. And then the world would be healthier, to be a healthier
Right.
place for us to
Right.
live.
Right. And that is all for this episode. If you just tuned in today, we were discussing the One Health approach as well as its relevance in fighting against infectious diseases. And as you heard, health for one, health for all. Don't forget to join us on our social media handles as Association of African Universities on Facebook and YouTube, AAUTV_African Universities on Twitter, and also AATV Official on Instagram. My name is Isabella Titahinakwa. See you again in our next episode as we still continue to discuss health issues and also exploring solutions for them. Bye.